I'm going to announce our next two speakers at the same time. One will follow right after the other. First up will be speaking about connecting for veteran health will be Dr. Shereef Elnahal, who serves as Undersecretary for Health at the Department of Veteran Affairs. So first, help me welcome Dr. Shereef Elnahal.
Good afternoon, everyone. It's great to be back at Health Datapalooza, representing a system that serves more than 9 million enrolled veterans across the country. And the main thing that we've embarked upon when it comes to the interoperability and health IT mission out of VA over the last couple of years now is our Veterans Interoperability Pledge. At this meeting in February of 23, I was excited to announce that 13 health systems would be joining us to pledge to better and more seamlessly connect veterans' health information to the VA and also to our private sector partners who serve 17 million veterans across the country. We have a mission at the VA to serve all veterans, regardless of whether they're currently tethered to VA or enrolled in VA healthcare. And of course, our goal is to get them enrolled and get them connected to the benefits that they have earned in service to this country. But even if they're not connected, when it comes to public health priorities like preventing veteran suicide, we believe that it is our obligation in the Biden-Harris administration to go to where veterans are, connect them to their benefits, and make sure that they get what they have earned by serving this country. And part of how we're doing that is the Veteran Interoperability Pledge. 13 health systems signed up to do three things: accurately identify veterans when they go and seek care at their institutions, either emergency care or longitudinal care; connect veterans with VA and community resources after they are identified, including benefits eligibility under the PACT Act, which is the President's signature legislation that expanded benefits to veterans exposed to toxic substances and assists us with ultimately connecting veterans who are at risk for suicide. And third, responsibly and reliably coordinate care by sending records back and forth seamlessly rather than dealing with snail mail and e-fax. So right now, we are proud to announce that 3 and very soon to be 4 of the health systems have connected to our Veteran Identifier API, meaning that at any site of care, their clinicians can now see whether their patient is a veteran or not, regardless of whether the veteran has told them that. Those health systems are Tufts, Sanford Health, and Marshfield Clinic. 2 of them are Epic institutions. 1 is a Cerner institution. And our 4th, Kaiser Permanente, is scheduled to go live this week. So congratulations to them as well. Now at Sanford Health, every veteran identified through the API is now given a brochure that outlines all of the benefits they may qualify for. And guess what? They've already identified that about half of the veterans that go seek care at their institution, for Tufts that number is 40%, actually have a condition that is now what is called presumptively connected to their service, meaning that if they apply for benefits under the VA, they're very likely to be granted potentially compensation and pension benefits for the rest of their life and healthcare enrollment in VA at little to no cost to them for the rest of their life. To date, they've identified 12,000 veterans at Sanford. Over 5,800 veterans have received this brochure, and nearly 250 veterans have already been referred to social work for important services and connection to VA benefits. At Tufts, they've identified 1,400 veterans on their rolls, or 22% of their veteran population, that they had no idea were veterans prior to our interoperability pledge. In fact, every veteran emergency room visit at Tufts is now screened for a suicide-related diagnosis, and if they ping that they have such a diagnosis, they are connected to VA for reimbursement under the Compact Act, which we announced earlier this year. Any veteran in suicidal crisis who comes into any emergency room across the country can now get that care covered by VA, regardless of whether they are enrolled in VA services or not. It is through interoperability and the interoperability pledge that we are getting this life-saving care and coverage for that care to veterans so that veterans never have to worry about seeking care when they are in crisis. At the Marshfield Clinic, since they went live in June, nearly 2,000 veterans have been identified in their emergency department and urgent care, 12% only who had previously self-identified as veterans. So we are talking about significant value at scale. And I am so proud to announce that both Epic and later today, you're going to hear an announcement from Oracle Cerner, have allowed their EHRs to connect to our Veteran Identifier API for any of their client health systems across America. Those health systems can elect or not elect to use this connection to our Veteran Identifier API. We hope the vast majority of them do, if not all of them, because every health system that comes online can identify whether they're in front of a veteran or not, which is really important clinically to serve that veteran, and very importantly, connect them to the VA for the earned benefits and health care that they deserve. This is proof in the pudding that we're not just talking about pie-in-the-sky work with interoperability. This is already changing veteran lives, and we hope that it changes millions of additional veteran lives into the future. Thank you so much for your time today. Appreciate it.